Common conditions of the respiratory system. Respiratory organs and tissues can be affected by a number of conditions. Some develop due to irritants that the client breathes, such as viruses and bacteria that cause infection. Other conditions develop due to disease or aging. Injuries or accidents can also affect the respiratory system. Breathing can be affected by broken ribs or damage to the diaphragm. It can be painful to breathe deeply when the pleura is inflamed. And medications can cause the breath to become slower and less effective. Some common conditions of the respiratory tract are asthma, allergies or anaphylaxis, lung infections, COPD or emphysema, chronic bronchitis, cystic fibrosis, and sleep apnea. Asthma is a chronic condition that causes an inflammation in the airways, causing the airway to narrow and swell, and they may produce extra mucus. This can cause your client to be very short of breath. It can trigger a coughing fit or a whistling sound or wheezing when they breathe in and out. Asthma attacks can be mild in some people and life-threatening in others. These attacks are often triggered by an illness or something in the environment, such as airborne allergens such as pollen, dust, mold, or pet dander, colds, physical activity, cold air pollutants such as cigarette smoke, certain medications, strong emotions or high stress, and certain food additives. The treatments for asthma involve avoiding asthma triggers, and they may use puffers or inhaled medications. There are two types of puffers that are generally prescribed. First are long-term control medications that are taken daily. These medications help keep the asthma under control and help your client to be less likely to have an asthma attack. The other type of puffers are quick relief or rescue medications. These are used when the client is having an asthma attack. Sometimes they're used to prevent an attack, like before exercising. They work quickly, but they don't provide long-term control. Your client might also take medications to help treat their allergies. Now, how can a home health aide help with their client with asthma? Always know what medication your client uses as a rescue treatment and know where they keep it in case they have an attack. Know what your client's asthma triggers are and avoid exposing them. Avoid wearing perfumes, including perfumed soaps or body lotion. Don't smoke, especially right before seeing your client. Help the client avoid illness. Do not enter the house if you're coming down with a cold. Learn to identify an asthma attack and help your client treat it quickly. If your client's breathing is getting worse despite using the rescue inhaler, or if they suddenly go very white or have blue lips, call 911. Asthma attacks called status asthmaticus can be very deadly. Allergies happen when your immune system reacts to something that normally does not cause a reaction. Some people will have mild symptoms, and for others, it can be a life-threatening emergency. Some people suffer from respiratory allergies caused by inhaling pollutants such as dust, mold, and pollen. As a home health aide, you must always make sure that you're aware of what contaminants or irritants you're bringing into the home, like perfume, soap, or even dog dander on your clothes or shoes. The symptoms of a respiratory allergy are sneezing, itchy nose, eyes or roof of the mouth, a runny nose, watery, swollen, red eyes, cough, chest tightness, wheezing, or shortness of breath. Some clients suffer from more serious allergies that cause anaphylaxis and may require an EpiPen. Typically, anaphylaxis happens from a food or insect bite. If your client has an EpiPen, be sure to read the instructions and understand how to administer it in an emergency. If you're unsure, ask your supervisor for some extra training. Symptoms of anaphylaxis are swelling of the lips, face, or tongue, severe shortness of breath, red skin or rash, wheezing or a whistling sound when breathing, a sudden drop in blood pressure, a rapid, weak pulse, lips or face turning blue, lightheadedness, and loss of consciousness. What should you do when your client is having anaphylaxis? Anaphylaxis is a life-threatening emergency. It happens fast and requires fast action. If your client is having anaphylaxis, get them to take their EpiPen. Call 911 and seek emergency help. Stay by their side. Anaphylaxis is terrifying for your client. Even if symptoms improve after taking the EpiPen, they still must go to the hospital. They will likely need more emergency medication.